l'utilisation intelligente des ressources. L'AIA, avec son expertise, sa légitimité scientifique et sa capacité de mobilisation, reste un partenaire de premier plan pour concrétiser cette vision. Mesdames, Messieurs, le combat contre le cancer en Afrique n'est pas seulement une urgence sanitaire, c'est une exigence éthique, un choix de justice, un impératif pour la paix sociale et un moteur de transformation durable. En tant que ministre, un levier central de la souveraineté sanitaire en Afrique. Je voudrais conclure en saluant le courage des patients, le dévouement des professionnels de santé, la persévérance des chercheurs et l'engagement des partenaires comme l'AIA. Ensemble, nous pouvons faire jaillir les rayons de l'espoir sur tout le continent africain. Je vous remercie de votre aimable attention.
Merci à vous, Votre Excellence. I now welcome His Excellency Mr. Lawrence Okeditse, Deputy Minister of Health of Botswana. His engagement in regional health collaboration and capacity development is a valuable contribution to strengthening national cancer services. Your Excellency, you have the floor.
Thank you, Director of Ceremonies, Director General of the International Atomic Energy Agency, Mr. Rafael Mariano Grossi, Your Excellencies, Ministers of Health, distinguished government representatives, permanent secretaries, partners and delegates, colleagues and friends, ladies and gentlemen, good morning. It is quite an honor for me to be here today as we address this gathering at the Race of Hope Forum, convened in Addis Ababa, a city that symbolizes the enduring spirit of African solidarity and Pan-African aspiration. And I bring with myself warm greetings from a new government in the Republic of Botswana, which was ushered in without much trouble, quite smoothly, even though it was for the first time in 58 years. And I bring with myself a commitment not only to a particular element, but a whole commitment to ensuring that we bring about a healthcare system that caters for everyone, as per your theme, to ensure that the inequalities that you speak about are not only at a global level, but then also internally within the country, between the rich and poor centers in the country are catered for. The moral imperative, we believe, for equity in cancer care is such that, as you have said quite eloquently, Director General, half of cancer patients in low and middle-income countries who require radiotherapy do not have access to it. To improve access, it is our key goal to introduce a national health insurance that will ensure that we bridge this gap between the haves and the have-nots in accessing medical care in our country. We believe that this is not just a statistic, as you mentioned, but a human crisis. It is the story of millions of people whose lives have been compromised or lost, not due to the absence of science, but due to the absence of access. It is as such a stark reminder that global healthcare and equity remains an unfinished agenda, and that radiation medicine, through technologically advanced, must not remain the privilege of a few. I want to share very quickly or briefly Botswana's journey in terms of access for most of our people. And our journey is best summarized as a journey from technical cooperation to national capacity. While the burden of cancer is rising in our country, as it is across the continent, we have responded not with despair, but with determination. And we have responded by building care capacity, particularly in radiation oncology, as has been shaped by science, solidarity, and strategic partnerships, foremost amongst them, our long-standing cooperation with the International Atomic Energy Agency. Through this cooperation, in 2023, we reached the national milestone when we were able to establish our first public radiotherapy center. And this center is not just a building. To us, it is a symbol of hope, as it reflects our deep commitment to building systems that save lives, uphold dignity, and advance equity for all our people. We do believe that through these partnerships that are technical cooperation projects with the IAEA, our robust human resource training and capacity development, and a comprehensive national needs assessment for cancer control in collaboration with the agency, we will be able to move even further. Each of these efforts represents a building block in our national cancer response, and they demonstrate that it is possible that we have strategic interventions when there is political will, strategic planning, and international cooperation. I want to move to the end by speaking to Rays of Hope and how you are improving access to systems integration. Botswana was admitted as a phase 2 country under the Rays of Hope initiatives, and this marked a new chapter in our journey. This designation is not merely symbolic. It positions Botswana as an active contributor to regional momentum for cancer control. Through Rays of Hope, we are moving beyond equipment installation to systems integration, and we are embedding radiation medicine into a comprehensive national cancer strategy, because it must be a component of a more comprehensive strategy, we believe. And moreover, the initiative has helped us envision a future where radiology, nuclear medicine, radiation oncology function as interconnected systems which are supported by robust referral pathways, quality assurance frameworks, and safety protocols. In addition to this, we are actually now putting in a lot of investment into our primary healthcare, such that we are able to then have early detection or screening of a lot of non-communicable diseases in order to be in a position to start early treatment and even focus on prevention. We believe that through regional cooperation and advancing Africa's collective agenda, this forum is a unique opportunity to reinforce regional solidarity as cancer is a shared burden across Africa, and it must elicit a shared response. Your Excellencies, let us use this platform to exchange evidence-based practices and lessons learned, strengthen anchor institutions and regional centers of excellence, explore innovative finance mechanisms and public-private partnerships, and advocate for policy coherence across sectors, including education, science, and infrastructure. Lastly, Your Excellencies, distinguished ladies and gentlemen, let us not regard Rays of Hope as a project with an end date. Let us embrace it as a movement grounded in the fundamental right to healthcare as enshrined in the Constitution of the World Health Organization and reflected in our own national values. Let us build a future where every child born in Africa, whether rural or urban, every woman battling cervical cancer, whether rural or urban, and every father that needs radiotherapy can access the care they need, not by chance, but through planning and by design. Let this be a generation that transforms radiation medicine from a symbol of technical advancement into a tool of human dignity and justice. On behalf of the people of Botswana, I want to share our sincere gratitude for your continued support and to also pledge our solidarity to our African brothers and sisters. Thank you so much.
Thank you, Your Excellency. I am now pleased to welcome His Excellency Mr. Frederick Huma Olunga, Principal Secretary at the Ministry of Health of Kenya, whose strong background in health system management is instrumental in advancing Kenya's robust cancer control efforts. Please, Your Excellency, the floor is yours.
To the Director General, Mr. Rafael Grossi, Excellency, Ministers, distinguished guests, all participants, ladies and gentlemen, good morning. First is to join in solidarity with my colleagues from African states who have expressed their gratitude to the International Atomic Energy Agency, and by extension other UN bodies that we are signatory to, for this support, and particularly for the Rays of Hope program. Secondly is to appreciate Professor Shaukat Abdulrazak, outgoing Director for Africa, and I would like us to give him a round of applause for the support that is given to Kenya, where we have benefited immensely from this program under your leadership, Director General, and we thank you so much. And thirdly is to mention that in this audience, I also have our CEO for the National Cancer Institute, Professor Elias Meli, who has been a beneficiary and a champion of the Rays of Hope program in Kenya. My colleagues from African states have emphasized the growing socio-economic challenges and burden of cancer and the costs for the healthcare system, and that goes for Kenya as well. And I would like to mention that the Kenyan government has been committed to expanding universal health coverage, and we are overhauling the mechanisms that we use to achieve access for the population through 4 key priority areas. One of them is the health financing mechanism, where we are pooling resources domestically for self-reliance, including financing for cancer care. And in this approach, we have established the Social Health Authority, through which we are engaging with private sector organizations, pharmaceuticals, to not only reduce the cost of treatment and interventions for cancer, but also to establish a system that improves experiences and outcomes for cancer care. Number 2 key priority has been the development of a health workforce that is fit for purpose, including a health workforce that is competent to educate, to prevent, to detect early, to diagnose early, to manage, and to support palliative and survivorship programs across cancer care. Number 3 has been access to commodities that we need for cancer care. And in the health products and technology policies, we are keen to introduce novel therapies to work with private sector as far as availing all the technologies and also all the therapies that our cancer patients need. And this has been greatly supported by the Rays of Hope, where we have benefited from 2 LINAC radiotherapy machines in Kenya. And the 4 key priority area has been on data visibility and unifying the healthcare system through information technology. And we have established a digital health superhighway that ensures that hospitals are connected so that patients can transport their data, so that we can have better visibility of data for planning, for resource allocation, and for policy alignment. I want to speak to 2 issues that are key for us in the future. One is that the whole aspect about cancer prevention, early detection, diagnosis, is still important. So as we discuss the interventions that we have made, and as we appreciate and celebrate the progress that we have made, it is important to connect with the communities and look for the source of the cancer so that we can have a comprehensive value chain that looks at how we prevent the cancers that are preventable, how we screen and detect the cancers that we may not prevent, even as we invest more in the interventions that lead to better experiences and better outcomes. In Kenya alone, 60% of cancer patients require radiotherapy treatment, and only 23% of our cancer patients have access to this comprehensive and life-saving intervention. And we want to not tire to thank the International Atomic Energy Association for this help. But as we look at bridging this gap so that we move from 23% to 60%, we are also keen to work with you to prevent more people from getting cancer, to detect the early cases so that we could reduce this burden of requirement from 60%, perhaps much lower than it would be. Secondly, is the financing mechanisms for cancer. The Director General, my colleagues from Africa states have mentioned innovative mechanisms of financing. Certainly, the landscape for funding healthcare systems is changing globally. Donor dependence in Africa is reducing. Domestic resources are not enough. So how do we move forward? How do we craft solutions that are going to align with the problems that we want to solve, that meet the needs, but also meet the context that is current in our challenges? And for that, we put this as a challenge, that this meeting also becomes a source of reflection on how financing architecture for cancer care should look like. I want to conclude by talking about the universal cancer care in Kenya. And certainly, we are keen to expand our access. We already have the National Cancer Control Strategy, which, together with our universal health coverage policy, calls for an integrated approach, the comprehensive value chain that I mentioned earlier. And to realize this vision, we need to unite our investments, we need to unite our policy actions, and certainly we need to strengthen our partnerships so that we make reality the shared responsibility to make cancer care a reality for everyone in the continent of Africa, including Kenya. And we ask international partners and donors to continue supporting Kenya through initiatives such as the Rays of Hope, and certainly to share expertise and experiences, because I have mentioned that the future requires innovation. Innovation requires that we exercise our minds a bit more, a bit deeper. We invite private sector and the civil society to collaborate in expanding oncology services and health education that is required for the populations. And we must commit to equitable access as our compass. But more importantly, we must scale our investment in this shared responsibility through radiotherapy, nuclear medicine, other novel therapies that we may not talk about here, so that we can transform cancer care from a death sentence from a death sentence, which it is for many of populations worldwide, including Kenya, to a manageable disease, to a disease that will be removed from the list of stigma, to something that populations will count as a curable infirmity. So these efforts require that we invest more. And for Kenya specifically, we are interested in expanding our regional centers of excellence. We are interested in stimulating research and innovation. We are interested in local manufacturing, and we would like to look at Rays of Hope as an accelerator in this approach. We must therefore be bold, we must be wise, and we must continue to work together so that universal cancer care, just like universal health coverage, becomes a reality in the near future. The lives that we save will be the legacy of this commitment, and that must continue to be how we measure our progress. I want to commit by stating that Kenya is very committed to the membership and participation in all IAEA's activities, and I once again want to congratulate you for bringing us together 3 years later to reflect on this journey, and specifically congratulate you, Director General, for your distinguished leadership. I welcome you to Kenya in the next few days, and we look forward to getting more support and also sharing our experiences in this journey to make cancer care a reality. Thank you.
Thank you, Your Excellency. And our deep thanks to all our distinguished ministers and senior officials for their inspiring remarks. Your contribution reflects not only national progress, but also the growing global momentum towards more equitable access to cancer care. We now turn to another segment, which was supposed to happen at 11:15. So I'm kindly and politely asking the donor member states to make sure their statement is 3 minutes, if possible. And of course, we are really honored to have you with us today for your unwavering commitment, which forms the backbone of the Rays of Hope initiative. And the support of your nations is not only financial, it is a testament to your leadership in advancing global health, equity, and solidarity. So we're honored to welcome a distinguished panel of ambassadors who represent countries leading the way in international cooperation and investment in cancer care. I'm pleased to begin with His Excellency Mr. Jens Annefeld, Ambassador of Germany to Ethiopia and Permanent Observer to the African Union. Germany has shown enduring commitment to sustainable development and global health, supporting initiatives like Rays of Hope to ensure equitable access to cancer care worldwide. Please, Excellency, the floor is yours.
Well, I'll try to keep this short, and I have trimmed. Director General, Ministers, Your Excellencies, ladies and gentlemen, dear colleagues, I would like to thank the IAEA and Director General Grossi for having me here at the Rays of Hope Forum, celebrating 3 years of this important initiative. It's an honor to be here to represent Germany, which is a strong supporter of this initiative. We see Rays of Hope as one of the major and most important flagships initiatives of the IAEA and its member states in the field of technical cooperation. Germany recognizes the importance of technical cooperation as a crucial mechanism to support particularly lesser developed countries to address pressing challenges and to achieve the 2030 Agenda for Sustainable Development. As the fourth largest contributor to the IAEA's budget and the TC Fund, and the largest contributor in the European Union, we emphasize that the necessity for this kind of cooperation is crucial constant and as relevant as ever, an important point at a time of shrinking budgets. Let me also say the technical cooperation activities of the agencies changed the nature of the IEA profoundly. Today, it is not any longer the exclusive club of countries that deal with nuclear energy. It is now an organization with manifold projects and cooperation schemes throughout the world, and in particular in the Global South. Rays of Hope is the best proof of this. And Rays of Hope is also an important piece of evidence that international organizations can successfully work together in many fields, like in the health sector. This is now more important than ever, as the UN itself is about to undergo comprehensive reforms, including by creating synergies between organizations. In this context, I would like to mention that Germany is the second largest bilateral donor of the WHO. In Ethiopia, Germany is supporting hospitals on a small scale through the so-called hospital partnerships, and 2 of the 7 German-funded Ethiopian clinics are supporting capacity building and trainings in the realm of oncology. Germany stands by its commitment regarding technical cooperation and the values it represents in the local and bilateral contexts, such as here in Ethiopia, as well as at an international level, for example, through the membership in the IAEA. We support the trend of a bigger inclusivity of the agency that is so successfully advanced by Director General Grossi. We have done so in the past, do so today, and will do in the future. We underline the importance of the safe and secure use of nuclear technology, particularly ionizing radiation in cancer diagnosis and treatment. Ensuring a well-trained workforce is absolutely vital to delivering quality care and something that all should have access to, no matter the country. More concrete, in 2023, Germany provided its first ever extra budgetary contribution to Rays of Hope and continued its financial support in 2024. This forum today is an opportunity to reflect on what we are able to do for cancer patients in low and middle income countries when we work together. And partnerships will be important to ensure the sustainability of the initiative going forward. In that area, I'm pleased to see that the IEA is partnering with a German company, Siemens Healthineers, to support the implementation of this initiative. The private sector has incredible expertise and capacity that they can bring to bear in tackling cancer. Together with the IEA's global mandate to encourage the safe and peaceful use of nuclear science, you can quickly and efficiently create change around the world by working together. Germany strongly encourages further collaboration with the private sector. In closing, let me reiterate Germany's commitment to the IEA and its cancer care work. Germany is determined to continue supporting the Rays of Hope initiative in the future, which in our opinion has become a flagship program of the agency, a program that clearly illustrates the significance and the potential of nuclear technologies. Thank you very much indeed.
Thank you, Your Excellency. Next, we welcome His Excellency Mr. Maurizio Buzzalnelli, Permanent Representative of Italy to the African Union and the United Nations Economic Commission for Africa. Italy continues to be a vital partner in the health system, strengthening and equitable access to care. Your Excellency, the floor is yours.
Director General, Ministers, colleagues, ladies and gentlemen. It is an honor to speak here today in Addis Ababa, where the Rays of Hope initiative was launched by the Director General, Rafael Mariano Grossi, 3 years ago. First of all, I wish to thank the African Union Commission for hosting this event. And let me also record the cooperation with the African Union and its member state is a key priority for Italy, as it testified by the progressive implementation of the Mattei Plan for Africa, launched at the Italy and Africa Summit last year, and were held being one of the 6 priority sectors of the Mattei Plan. The Rays of Hope is a concrete example of the multiple civil application of nuclear science. We commend the International Community Energy Agency's work in promoting such contribution of nuclear technologies, particularly in the medical and the healthcare domains. This event is also an occasion for us to acknowledge the contribution made available by all donors whose resources are crucial to this initiative. Italy fully supporter of Rays of Hope in expanding access to cancer treatment and diagnostic capabilities in underserved regions. Rays of Hope fully aligns with the priority of the Italian G7 presidencies last year, as is stated in the final communique of the 2024 G7 ministerial meeting on health. In the communique, we underline the need to increase coverage and adherence levels and to reduce regional and geographical disparities and inequalities in access to cancer prevention interventions. We contribute to co-found Rays of Hope programs in Syria and Iraq, reaffirming its strong commitment to strengthening the global coalition for cancer care and advancing the United Nations Sustainable Development Goal 3 on good health and well-being. The funds enable practical training for Iraqi medical professionals, strengthening local expertise in the use and maintenance of maintenance equipment. The package provided to Syria include materials to enhance precise cancer treatment and safeguard adherence to international safety standards. This effort is part of Italy's broader commitment to supporting Syria and Italy's engagement in providing healthcare support to crisis-affected countries. We believe in promoting training and technological innovation as key drivers for reconstruction and resilience. In addition to Rays of Hope, Italy's contribute to the International Atomic Energy Agency initiative in the field of technical application of nuclear energies, also through the Abdus Salam International Center for Theoretical Physics, which is based in Trieste. The ICTP holds a master in medical physics aimed at specialists from low-income countries, thus playing a crucial role in the training of health and medical personnel. I want to conclude by underlining that we are honored to be part of this flagship initiative, and we intend to continue to fully support the agency project in the health sector. Thank you very much.
Thank you, Your Excellency. I now invite His Excellency Mr. Tsutumi Nakagawa, Ambassador Extraordinary and Plenipotentiary to Japan to the African Union. Japan has a rich legacy of promoting science, innovation, and international development, and remains a state-fit supporter of the IAEA cancer control effort. Please, Your Excellency, the floor is yours.
Thank you very much. And the DG of the IAEA and distinguished ministers of African countries and all delegates and participants. Firstly, I would like to welcome the convening of this forum and express my great honor to participate as a donor country. Japan attaches great importance to the nuclear science and technology, which contributes to resolving global challenges, including achieving the SDGs, and thus has enhanced the international cooperation in this regard. Needless to say, Japan, as the only country who suffered atomic bomb in Hiroshima and Nagasaki, has always been a strong supporter of the IAEA, especially for the peaceful use of atomic energy. Japan supports IAEA's initiatives, which aim to address the development challenges for member states in an effective and integrated manner, particularly Rays of Hope, which improves cancer treatment and diagnostics capabilities and saves the lives of cancer patients since its inception 3 years ago here in Addis Ababa. For instance, the government of Japan has provided Senegal, one of the first wave countries, support for the procurement of the medical cyclotron and fellowships on nuclear medicine and radiotherapy, and supported Ukraine in developing specialists, including the establishment of training centers. This year, we have also decided to support 22 African countries in providing mammography equipment for breast cancer detection, and support Ukraine in providing equipment for brachytherapy for eye cancer. I understand tomorrow at this forum, one of the leading Japanese company, Fujifilm, will make a presentation. So please be aware of that. Moreover, trilateral cooperation in the medical radiotherapy has been underway among Japan, the Republic of Honduras, and the IAEA. Japan is set to provide Honduras with a linear accelerator. Of course, cancer is a common global issue. In order to expand access to radiotherapy to all in need, sustainable assistance provision is crucial. Therefore, Japan not only operates its own anchor center, but also assists its activities of other anchor centers which serve as a regional hub. We are very proud that we have successfully organized a network of 16 institutions, including universities, hospitals, and research institutions, nationwide as Japan's anchor center, the first center in Asia. This network facilitates the provision of suitable assistance utilizing its wide variety of resources. It has already hosted some regional training courses since its designation in March 2024. In addition, we are planning to host another technical meeting on advanced radiotherapy, and this time we intend to invite radiation oncologists and medical physicists from all other anchor centers to strengthen their capabilities by sharing advanced knowledge and expertise. We are convinced that this approach will enable the participating centers to train experts in their own regions even more effectively. The government of Japan has provided more than 14 million euros to support Rays of Hope initiatives through projects I've mentioned. Furthermore, Japanese public and private entities and experts also have cooperated with the IAEA. During the IAEA DG's visit to Japan in March 2024, Aizu Central Hospital of the General Incorporated Onchikai Foundation made a donation of 100,000 euros. This, combined with contribution from the Japanese government, is being used to support anchor centers outside Japan, specifically through providing VR headset for personal trainings. Donations were also received from private companies, namely Chiyoda Technical Corporation, Nihon Mediphysics, Sumitomo Heavy Industries, and Tokyo Nuclear Services. They have been utilized for personal training in Africa. We are confident that this public-private partnership strongly pushes forward the IAEA's activities. Lastly, as we recognize a growing number of voices for support through Rays of Hope, we hope that this forum will further accelerate Rays of Hope initiatives, including attracting new donors and expanding participants. Thank you for your kind attention. Thank you very much.
Thank you so much, Your Excellency. We are now pleased to welcome Monsieur Julien Voiturier, First Counselor for the Embassy of France to Ethiopia and the African Union. France has long been a strong advocate for multilateralism and global health equity and has actively supported cancer control through international cooperation, including its engagement in the Rays of Hope initiative. Monsieur Voiturier, vous avez le.
Excellences, chers participants, tout d'abord, permettez-moi de remercier l'Agence internationale de l'énergie atomique et l'Union africaine d'organiser ce forum. C'est un plaisir pour nous, la France, d'être ici et de souligner à cette occasion notre soutien de longue date aux efforts de l'AIEA dans la lutte contre le cancer, à travers notamment son programme d'action en faveur de la cancérothérapie et l'initiative Rayons de l'espoir lancée par son directeur Raphaël Mariano Grossi en 2022. Au-delà de ces applications connues évidemment pour la production d'électricité, la science nucléaire est aussi un moyen fondamental de renforcer la santé humaine et en particulier de lutter contre le cancer. Toutefois, la répartition très inégale des moyens de lutte contre le cancer et de diagnostic à travers la planète est un des principaux obstacles que cette initiative Rayons de l'espoir cherche à lever. Dans ce contexte, la France a toujours fait de l'accès à la technologie nucléaire pour la santé humaine une priorité. Et nous sommes très heureux de pouvoir travailler avec l'Agence internationale de l'énergie atomique, notamment à travers nos 2 centres collaborateurs, l'Autorité de sûreté nucléaire et de radioprotection et l'Institut national des sciences et techniques nucléaires. Le renforcement des capacités est un des aspects principaux du soutien de la France à l'initiative de l'AIEA. Puisque nous sommes ici à l'Union africaine, laissez-moi souligner le travail que nous faisons avec un certain nombre d'États africains pour les soutenir dans leurs efforts en la matière, en particulier le Bénin, la République démocratique du Congo, la Côte d'Ivoire, le Maroc, le Sénégal, la Tunisie ou encore le Rwanda. Plus tôt ce matin, les ministres de la Santé du Bénin et du Sénégal nous ont présenté leurs efforts ambitieux dans la lutte contre le cancer. La France soutient ces 2 États modestement dans leur lutte contre cette maladie. Par exemple, au Bénin, le réseau des hôpitaux de Paris et Bouygues Construction soutiennent la construction d'un département de radiothérapie et de médecine nucléaire au centre hospitalier universitaire Abomey-Calavi. Et au Sénégal, nous participons aussi à la formation des radiopharmaciens et des physiciens médicaux qui sont formés donc à l'Institut national de sciences et techniques nucléaires français avec le soutien de l'AIEA. Enfin, avec d'autres États africains, par exemple le Maroc, la France contribue à la mise en place de formations comme un master en radiopharmacie à l'Université Mohamed V de Rabat, en coopération toujours avec l'Institut national des sciences et techniques nucléaires français. Plus largement, nous soutenons à travers le Fonds de coopération technique l'initiative Rayons de l'espoir de l'AIEA et son action à travers le programme d'action en faveur de la cancérothérapie. Laissez-moi conclure cette brève intervention pour rappeler l'engagement complet de la France dans la lutte contre le cancer et la mobilisation des technologies nucléaires dans ce but. C'est un combat pour qu'il puisse être réussi qui demande un accès équitable aux moyens de diagnostic du cancer et de lutte contre la maladie. Et c'est pour cela que l'initiative Rayons de l'espoir est aussi importante. Ensemble, nous pouvons faire de cet espoir un succès. Merci beaucoup.
Merci. Merci, Votre Excellence. We have been able to compress time. I'm very grateful. Thank you so much to all the speakers. Today, we are delighted to mark an important milestone, the launch of a new partnership between the IAEA, International Atomic Energy Agency, and the St. Jude Children's Research Hospital. St. Jude is a global leader in pediatric cancer research and care, and this collaboration represents a significant step forward in expanding cancer services for children across the globe. It is my true honor to invite Dr. Carlos Rodriguez Galindo, Executive Vice President and Director of St. Jude Global, to share a few remarks. Professor Galindo, Doctor, the floor is yours.
Thank you so much, Sophia, and thank you all of you for this time. So His Excellencies, the Director General of IAEA, as well as His Excellency, the Deputy Prime Minister of the Federal Democratic Republic of Ethiopia, all the representatives from ministries of health of African countries, esteemed delegates, colleagues and participants. So it is an honor for me on behalf of everyone at St. Jude to stand here in front of you today to announce and to celebrate the launch of a renewed partnership between St. Jude Children's Research Hospital and the International Atomic Energy Agency that seeks to accelerate access to quality care for children with cancer in the world, wherever those children might be. And no better place and time to announce this than today and here as we convene to share the progress that has been made over the last few years in the Rays of Hope initiative and inspire each other to make sure that the Rays of Hope are for everyone and everywhere. St. Jude has been committed to the fight for the life of every child with cancer and finding cures and hope for those children since the day it opened its doors on February 4th of 1962. On that day, Danny Thomas, the hospital founder, declared what has been the guiding principle of our institution, that no child should die in the dawn of life. And since that day, St. Jude has remained committed to make sure that that dream is a reality for all children with cancer in the world, wherever these children might be. The determination of Danny Thomas, the founder, was met with the vision of the first director of St. Jude, Dr. Donald Pinkel, the man that showed us the value of integrating research and service. When in the first years of research to find a cure, Dr. Pinkel was asked what were the major obstacles in hindering progress towards the cure of acute lymphoblastic leukemia, he said, drug resistance, drug toxicity, meningeal relapse, but most importantly, pessimism. I like always to get back to that quote because so much has changed since then. Now, 60 years later, we are filled with optimism. More than 80% of children with cancer can be cured when the appropriate resources and the national health system's strengthening plans are available and in place. But this is not enough. More than 80% of children with cancer live in countries with limited resources, and many of them are not even diagnosed. So of the more than 400,000 children who develop cancer every year, more than 300,000 die, and most of them die without even being given the chance to fight for their lives. These disparities are even more pronounced in Africa, a region where St. Jude Global is placing a special focus, which we hope to enhance and augment through this partnership with IAEA. So we have advanced through the Millennium Development Goals of decreasing under 5 mortality rates, and as a global community, we have given children the gift of life. However, we truncated our commitment and mostly abandoned them when the new need came to help them fight for their lives when cancer threatened them. These are preventable deaths in the dawn of life, their young faces looking at us, asking us not to forget them, and telling us that they are here, they are there, they are everywhere, waiting for us to hear their call and come to their rescue. So we have a long way to go, but it is our responsibility as international organizations and governments to address these global disparities and to create a better future for those children. I am constantly reminded of the principles of the 1989 United Nations Convention on the Rights of the Child that include the right to non-discrimination, the right to survival, and the right to development. At St. Jude, we are committed to help make this dream a reality. Through the St. Jude Global Program, we work to increase capacity, to facilitate access to quality care, reduce the workforce gap, through a comprehensive educational initiative and by fostering research to generate the evidence that is needed for a transformative advance. And finally, through resource mobilization programs to help sustain models across the world. We work in partnership with many institutions and governments to improve access and quality of care for children with cancer while developing networks that can accelerate and transform it. The St. Jude Global Alliance is today the collective effort of more than 400 programs in more than 90 countries working day after day, innovating and transforming. The St. Jude Global Dream also took us to the creation of the Global Initiative for Childhood Cancer together with the World Health Organization and many other partners, working with governments to develop sustainable childhood cancer control plans with the goal of increasing survival for children with cancer to 60% by 2030, saving more than 1 million lives and reducing suffering for all. The GICC works with governments to design and implement national childhood cancer control initiatives through the Cure All technical package that St. Jude helps implement. These efforts have now taken us, together with WHO, UNICEF, and the Pan American Health Organization, to the development of a global platform to facilitate uninterrupted access to essential, good quality medications for all children with cancer. With an initial investment of $200 million from St. Jude, the global platform for access to childhood cancer medicines is much more than a drug donation program. It represents a unique opportunity to build on the progress made through the Global Initiative for Childhood Cancer in health systems strengthening to ensure that medicines are delivered in systems and facilities that can provide comprehensive quality of care for children with cancer. The first 6 pilot countries, representing each of the WHO regions, started receiving the medicines in February of this year, and the next group of 6 countries are now being onboarded and on track to receive medicines by the end of this year. As the global platform expands, in the next 5 years could benefit more than 120,000 children in the more resource-limited countries. So this collective journey has brought us here to this partnership with IAEA to continue to build capacity and strengthen services and systems globally to give every child with cancer the hope of cure and the gift of a healthy life. Through this renewed partnership, we will bring together the expertise and strength of St. Jude in the care of children with cancer and in the development and implementation of tailored initiatives to address local and global disparities, with the expertise and the strength of IAEA in health systems strengthening and in the development and implementation of programs to accelerate access and quality of diagnostics and radiation therapy for people with cancer. This collaboration that we are launching today will deepen our technical partnership and will provide the agency with the financial and technical resources to expand its works in the Rays of Hope for childhood cancer and to strengthen the impact reviews and the NCCP program so it can offer a specialized focus on childhood cancer as well. This initial phase is for 3 years, where we'll be collectively developing these global goods while we develop plans for further expansion. The Rays of Hope program offers a unique ecosystem to continue to build on the progress made through St. Jude Global, the WHO, GICC, and the Global Platform for Access to Childhood Cancer Medicines, and accelerating our pursuit to reach every and single one of the children with cancer in the world, wherever they might be. The centers and the professionals that care for them, and the governments that seek our advice and support. As St. Jude and the St. Jude Global Program, we are committed to work with IAEA and their hope partners to address these global disparities since the day the hospital opened its doors, and our determination is the same, as strong as it has ever been, to ensure that every child with cancer will have access to quality care and treatment no matter where in the world they live. We synergize our efforts with all of you, sharing your goals and vision. We fight the same fight and we pursue the same goals with a comprehensive approach that we need to achieve success. So today, June 30th, 2025, will be remembered in our collective memories as the day when St. Jude and IAEA stood up together to assert our commitment to continue to fight for the lives of children with cancer of the world, so we can tell them that we are here, we have heard their call, and we will not waver. So ainsi, aujourd'hui, le 30 de juin de 2025 restera gravé dans nos mémoires collectives comme le jour où St. Jude et la IAEA se sont unis pour affirmer notre engagement à continuer de lutter pour la vie des enfants atteints de cancer dans le monde. Nous sommes là, nous avons entendu le rappel et nous ne faiblerons pas. Thank you very much. Merci beaucoup.
Thank you, Dr. Rodriguez Galindo. And thank you to all our esteemed donor representatives and partners. Your steadfast commitment is not only saving lives, it's building systems of care, restoring hope, and reshaping future for future generations to come. We now are delighted to continue with a presentation from our host country, Ethiopia. Please join me in welcoming His Excellency Mr. Dereye Duguma Jemeda, State Minister for Programs at the Federal Ministry of Health of Ethiopia, who will share insight into Ethiopia's progress in expanding access to cancer care. Excellency, the floor is yours.
Thank you very much, Excellency Ministers, Excellency DG, delegates from the different countries, ladies and gentlemen. I think it's good afternoon, Naya. I don't have my phone. Thank you very much for arranging this important high-level meeting in Ethiopia's hosting country. We're so much honored to host this important event, and welcome to your city, Addis Ababa, and also to Ethiopia, your second home. And I'm so much honored to get this chance, and I will be very, very brief. Our Minister, Dr. Magdas, has highlighted the success and the challenge that we have in the fight against cancer in Ethiopia. I will have just only a few slides, 6 slides, and on every slide, I will not take more than 10 minutes. Do you agree? I'll be very brief. So having this said this one, yes, just to give the bird's eye view of what Ethiopia looks like, and also the burden of cancer and in general NCDs in Ethiopia. So basically, as you can see, Ethiopia is a very big country, the second most populous country in Africa, with a population estimate of more than 120 million by 2025 estimates. And talking about non-communicable diseases, Ethiopia, especially over the last 1 decade, has seen alarmingly big numbers in terms of NCDs in general, and particularly cancer. So more than 51% of diseases in the country happen because of non-communicable diseases and injuries combined. You can see the demographic changes, and also the epidemiology of disease pattern in Ethiopia have changed a lot. And actually this is happening in everywhere in Africa and also beyond. And actually more than 10% of diseases in the country happens because of cancers. And as you can see, every year we receive more than 80,000 new cases of cancers, and 55,000 diseases happen because of cancer. So this is a huge number in terms of the burden of cancer in Ethiopia. And unfortunately, I mean, the top cancers that we diagnose every year are breast cancer, cervical cancer, and colorectal cancer. And actually, some of these issues have been highlighted during the welcoming address of our Minister, Dr. Magdas. Unfortunately, 70% of our people come to health facility with advanced cases, and most at this time is nearly impossible to give them a cure, and mostly we give them palliative care and other advanced care to prolong their lives. And that is actually a tragedy to see mothers coming with advanced cervical cancers and waiting few months to survive. So we have to act now and immediately to fight against these deadly cases. Just to inform you that the health system of Ethiopia is a 3-tiered health system. And basically, at the base, we have primary care system, and in these primary care units, we have trained health workers, especially health extension workers. We have more than 40,000 payroll-based health extension workers. And we do have also other health cadres in health centers and primary hospitals. And they are the basis for our intervention in cancer and also beyond in other communicable, non-communicable, and also other these entities. And actually we have a second level, the secondary care, and also at top level we have tertiary care and facilities that you see in bigger areas. Next. So this is a summary of what I want to present in my presentation. In short, so this is the milestone in Ethiopia's cancer control. So the journey of the fight against cancer in Ethiopia is highlighted in this PowerPoint presentation. So back in 1999, almost before 2 decades, the first radiotherapy center has been established in Tash, Tukur Ambassa Specialized Hospital. And we are also so much honored today to have a high-level visit to this hospital. And IAEA support was an important support at that time. So we have been provided with 2 cobalt-60 unit machines, and amazingly, these machines have been functional over the last 2 decades, and millions of people have benefited from this machine. Even though they are an old technology machines, they have served to their best, and recently, by support of IAA, they have been decommissioned and they have been replaced by the new technologies. And then the next 15 years were a bit silent in the fight against NCDs. I mean, mostly we have been tackling communicable diseases in Ethiopia, but 2015 has been a turning point for the government and also for our community. We gave a due attention for cancer, and the first National Cancer Control Plan have been endorsed by the government and have been operational by 2015. And in the same year, we have introduced cancer medicine subsidy to reduce financial burden in the care of cancer. Our colleagues, ministerial colleagues from different countries have highlighted the financial burden of our communities. As we all know, cancer diseases is not an individual disease. Families will get sick together. And the socio-economic impact of cancer is beyond the health. That's why we always, as a government of Ethiopia, we always promote whole of society and whole of government approach in terms of fighting NCDs and also cancer and of course, many other diseases in Ethiopia. So the government is, for example, last year alone, we have subsidized more than 2 million USD from the treasury of the government to reduce the cost of these drugs. As you know, anti-cancer drugs are very expensive and they are not easily accessible, and people sometimes have to bring from abroad through relatives and also through airlines, and that is really very difficult. But now, and actually only few pharmaceuticals produce these drugs. And as a government of Ethiopia, we have tried to subsidize, and actually cancer care has been covered by insurance system, even though usually most of our health facilities have not adequate supplies of these drugs, but there has been a serious support from the government on this side. Same year, national scale-up of cervical cancer screening and treatment have been started, and we have a very rich experience on this one. I think going forward in the afternoon tomorrow, it will be a very good chance to learn from each other. Ethiopia will share our experience, and we are also keen to learn from our brothers and sisters in different countries and also from the colleagues who are here. So we've started with few centers, but today we have more than 1,500 health centers and hospitals that provide cervical cancer early screening and also treatment at different levels. And this is basically a huge accomplishment. And so far, we have screened more than 1 million women, reproductive age women, between 20 and 49 years, and that is really an important support from the government and also from our partners, and they are getting treatment in the nearby health facilities. And an amazing commitment from the government can be seen through the expansion of radiotherapy and diagnostic image in 5 regional areas. And actually the plan is 7, 5 have been functional by this time. As you can see, the commitment and the investment from the government is really huge. More than 25 million euro have been invested on this important support. And actually, the Ministry of Health and the Ministry of Education have partnered on this one, and we have selected teaching hospitals from 7 centers, and we are working on them. And this is a big achievement, and you can see the government is really very committed to this one. 2016, again, oncology training program have been launched in the biggest hospital, Tukur Ambassa Specialized Hospital. As Minister Mekdas have rightly mentioned during the welcoming address, more than 50 clinical oncologists and 17 nuclear medicine specialists have been trained, thanks for the support of IAEA. 2019, Ethiopia joined the WHO Global Initiative for Childhood Cancer, and I'm so much honored to have represented from the St. Jude's Children Research Hospital. Your partnership through different projects like the Aslan project have been very instrumental for us. Your engagement and your support again has continued, and thank you very much. As you know, in Ethiopia, a significant amount of childhood cancer have been documented now, and previously it was not actually prioritized, but now with the current cancer control program, we have prioritized pediatric cancer. 2022, Ethiopia co-hosted the launch of IAEA, as the DG had been rightly mentioning, and also our ministers Dr. Bellata, Dr. Magdas have said, and the Race of Hope initiative has been launched right away in this room, and that was an important milestone in the fight against cancer in Ethiopia and also beyond, and it has been truly hope for millions of people in Ethiopia, in Africa, and beyond. 2025, currently, we have about to launch the second National Cancer Control Program, and there have been very big departures. And through this departure, we aim to achieve SDG 3.4, which aligns with NECDs, especially to halt premature deaths because of NECDs in general, and particularly cancer. And actually, we have prioritized early detection. Our approach toward this cancer prevention has 4 pillars, and the first one is promotion of healthy behaviors and also prevention of risky behaviors, as it was mentioned by different speakers. And now the second pillar is early screening, especially for cervical cancer and also breast cancer, and also HPV vaccination. For example, before a couple of months, we have vaccinated more than 7 million adolescent girls in Ethiopia, and this is a huge achievement, actually. And the third pillar is chemotherapy and surgical intervention and also radiotherapy intervention. And the fourth one is the palliative care. And actually, the palliative care has been introduced recently in the new cancer control program. And actually, we have also focused on equitable access, and we have included childhood cancer in the new cancer control program. Next. Saying this one, our collaboration with IEA, Race of Hope, through the Race of Hope project and also other support have been very instrumental in Ethiopia. And this strategic support from IEA has been provided to Ethiopia. And the first one is the radiotherapy capacity building through equipment and notably through training of our healthcare workers, which is very important support actually. And of course on safety. I think what I want to address on safety is the government of Ethiopia is also committed to have to form an institution that works on regulatory framework. And I can see right away Dr. Solomon, who is also the DG, the head of Ethiopia Technology Institute under His Excellency Dr. Bellata. And these institutes works on the safety and also on the regulatory framework of radiation therapy in general and also other chemicals actually. So basically we're so much serious on regulatory frameworks and actually not only for radiotherapy but also for ultrasound, X-ray and any other medical equipment we take a serious measure. Nuclear medicine support, that will be visited soon, and actually here Tukur Ambassa Special Hospital has benefited from support of IEA in terms of establishing nuclear medicine. That is a very huge investment, and it's also a hope for millions of people in Ethiopia. The oncology workforce development, as I've said, medical physicists, RTTs, oncologists have been trained by support of IEA, and that is a huge compliment, and would like to have more support in this area. And especially on national cancer control planning, the partnerships that we had with IEA had supported us a lot, and it's because of that huge support that we had this planning every few years. And technical cooperation impact mission, I have to mention that IEA, WHO, and other partners have joined a very huge undertaking in terms of assessing the previous national control cancer control plan in Ethiopia. They have visited many areas, and there was a huge mission. And based on the recommendation, we have designed and about to launch the second national cancer control program. And huge thanks for IEA for supporting us in having updated recommendations, which are global recommendations that will serve the cancer fight in Ethiopia. Last, Ethiopia remains committed actually to ensure safe, high-quality radiation service in line with IEA safety standards. So these are some of the huge partnership and support that we have got from IEA. Next. What were the achievements? Some of them have been highlighted by Dr. Magdas, and I've also said some of them. 5 functional radiotherapy centers have been there now functional. Addis Ababa, Jimma, Hawassa, Harar, and Gondar. And some of them, for example, Jimma is about 350 kilometers away from Addis Ababa. Hawassa, about 200. Harar, about 500. Gondar is nearly 600 kilometers away. So Ethiopia is a very huge country. We need to have this service in decentralized form, as has been said by our ministers from different countries. So Ethiopia has committed seriously on having decentralized radiotherapy centers, and they are functional and they're providing services. And as you know, especially the other costs, transportation costs, and also many other costs have been covered because of having these services closer to the community. All of them have been equipped with LINAC variant type, and that has been supported by our partners and the IAEA. And actually, the first gamma camera and nuclear medicine, which have been operational at Tukur Anbassa, as I've said, our professionals, including radiation oncology, nuclear medicine professionals, and oncology nurses have been trained for this purpose. And now we're working on having a comprehensive oncology center in St. Paul Millennium Medical College Hospital, another big hospital in the city center. And actually, during the impact assessment, this center have been already visited, and actually the government is having private partnership to make functional this center. And I'm sure with this investment, Ethiopia will be a hub for radiotherapy center and also comprehensive cancer treatment center. And I'm sure with the neighboring countries and also with other countries in Africa will bring cancer care to a new level going forward. And this center in St. Paul will be an important center, not only for Ethiopians, but also for other African brothers and sisters. And also in Mekelle, in the northern part of Ethiopia, we're about to also have a similar radiotherapy center. Next. What are the gaps? I think this is the last one. Gaps and opportunities for impact. Now, still, we have limited access. You know, it's always said that one radiotherapy center service 1 million people in Ethiopia, and even with the current estimates, maybe closer to 150 million. So, you know, we need more than 100 radiotherapy centers. I mean, that is the standard, but I mean, the investments that have been on the ground so far are very encouraging, but we still need to have more radiotherapy centers, as other member countries have been saying, and we're working on that one. And still, support from partners in the IAEA is also crucial on this area. The need for additional LINAC and radiotherapy planning system is very important. And an important milestone in Ethiopia is we have 2 bunkers, and just having one machine, it could be brachytherapy or LINAC machine, could also double care that we provide for our patients, because when we designed, we made deliberately that 2 bunkers have been constructed in those centers. The nuclear medicine expansion is also needed in regional referral hospitals, as we have only in the biggest hospital in the city center. And also healthcare workers, we need to train them more, as the need is quite very huge. And also one important thing I want to flag on this platform is Ethiopia has started cancer registry that is based in our facilities in Addis Ababa. And actually want to have a scale, we want to scale up this cancer registry to national level. And we need more training and more capacity. It's not an easy job, but it's very important right now. And it's through this cancer registry that we can really we win the fight against cancer. We need to have an updated data system on this one. I think a colleague from Kenya have been talking about data system. So we are also working on this one. More partnership and support is needed going forward. Next slide. Yes, this is the last one. Looking ahead, I think the infrastructure will be very important. We have to invest. Actually, it's unfortunate that this time different aids and foreign assistance are decreasing, but we need to mobilize resources from different sources, and we have to also effectively utilize the available resources. And I'm sure our partners, ambassadors, member countries will prioritize cancer during planning, including the government to mobilize more resources to fight these deadly diseases. And of course, IAEA would also, I'm fully confident that the DG have agreed to partner more and to support member countries to have capacity in terms of fighting NCDs and also particularly cancer. So we need to mobilize more resources, especially in terms of having more infrastructure. And actually, pediatric and palliative care service have been really forgotten. in the case of Ethiopia and actually in many other countries in Africa and beyond. So, I mean, this is a right time to focus on pediatric care and also palliative care, and it should be reflected in our plans. I'm so much privileged. Before 3 years, I've met the DG, and what have been done over the last few years have been realized because of the robust partnerships that we had with IAEA and its leadership. And we are so much honored to have also the DG and his team with us over the last few days in making this Rays of Hope conference a reality. And expanding access to essential cancer medicine will be an important assignment for all of us, I think. I mean, we have to promote local production of essential medicines for cancer, anti-cancer drugs, here in Africa and the soil of Africa. It's also a huge agenda for AU and Africa CDC, and also for our leadership. Dr. Magdan, since she joined the ministry, she has been always promoting this local production, and we're really proceeding very well. And with other member countries, we can make this a reality. And of course, having affordable drug is also very important. I think the cost and also, most of the families have been bankrupt because of treatment of cancer. I mean, all the family will get sick together, as we have been saying. It's a community burden. It's not single individual disease, as we all know. So we need to have an affordable and accessible drug, and we have to work on this one. This is still an outstanding challenge. Integrating cancer into universal health coverage will be very important. Ethiopia is known for the robust primary care system we have, and we have included NCDs in general, but particularly cancer, especially in terms of advocating for prevention and trained to work on the risk factors, tobacco, smoking, and also lifestyle modifications, diet-related matters, exercise, and so on. That's why the government of Ethiopia is also making cities really very beautiful. I think most of you have been impressed by the outlook of Addis Ababa, the seat for AU and many other international institutions. And I mean, these investments will help us fight against many NCDs and cancer. So we have to also promote those type of investments, and we have to also integrate every activity into the primary care system. I mean, cancer care is very expensive, and as much as possible, especially in the setting of African countries, we have to work on the prevention and the promotion of healthy lifestyles. Mobilizing resources, I've already said, and also having strong partnerships with IAEA, WHO, and other partners, including St. Jude, and also other projects will be very important together, and also including NCDs and cancers into the different projects that we have with different partners will be very important. In conclusion, together we can close the cancer care gap, and we shouldn't leave no one behind in terms of giving care. So SDGs without cancers will be not full SDGs. So let's bring our efforts together, and let's fight cancer, and let's envision having no cancer cases in pediatric age, and also in adult age in different countries, including Ethiopia. Thank you.
Thank you very much, Your Excellency, for your thoughtful remarks and for sharing Ethiopia's experience and progress in strengthening cancer care systems. This concludes the different presentations and remarks we had this morning. So we'll now break for lunch and reconvene, please, at 1:55, so we can begin at 2 sharp for our next session this afternoon. Now I'm calling for the announcement. So the lunch is on the 3rd floor of the Milesian building.
Thank you very much for well-attended summit and for all the speech from excellencies. And now the lunch is at Meles Zenawi building, just in front of us. So let's come in time. Thank you very much.
ይኸው የሀብቴ ዱንብላላ እንትና
የሚያናድደኝ ነገር